in your GI tract, okay, your body has many, many, many CB2 receptors. Now, something to keep in mind, your body makes its own cannabinoids. These cannabinoids bind to these receptors in your GI system, and your endocannabinoid system plays a close role in regulating bloating, gas, constipation, bowel regularity, okay? All these different things. So by activating these receptors in our gut, we can aim to normalize our bowel movements. We can aim to try and attack bloating. I think this is one of the reasons we see so many women, believe it or not, who suffer from PMS and they have all that bloating and they're saying, I didn't eat a thing today. It's probably more the hormonal imbalances than it is really what they're eating. And we see CBD provide them with huge benefit. So that's one area. You have the CB2 receptors in the lining of the GI tract. CBD oil indirectly affects those receptors, turns on our endocannabinoid system, and we see this balance occur. Now, the other big thing, I think I say this in every podcast because it comes up over and over again, when they actually looked at mice, when I believe some studies were actually done with humans too, who were suffering from colitis, they found that they had increased levels of an enzyme that destroyed the body's own cannabinoids. And when you take CBD oil, it blocks that enzyme, allowing your body to produce more of its own cannabinoids naturally. And they found that these people were also getting relief from GI distress. And that was one of the other proposed mechanisms. Now, I don't have in-depth details, but there's a lot of interest right now in how CBD affects the brain and what that can translate over to the gut. So for example, if we've done podcasts on anxiety and PTSD, someone's suffering from PTSD, at least we see this all the time, especially with our chronic pain patients, they usually have GI issues as well. Well, if we can affect that PTSD by using CBD oil and affecting how the brain is registering those adverse memories, are we then positively impacting the gut by impacting the brain on top of stimulating the endocannabinoid system in the gut as well? In my opinion, absolutely. And this, we see great results with this every day. So you have a few different ways that CBD oil is playing a role. It has a direct effect on the CB2 receptors in the gut. It affects that enzyme that's eating up our body's own cannabinoids. It quiets that enzyme down. And then it also impacts our brain function in a very positive way to almost allow for a clear communication between our brain and our gut when it comes to those neurotransmitters. So you're getting like a triple whammy on this one when it comes to benefit. That's a great question. So this is one of those ones too where I would advise people to be aware. CBD is biphasic. What does that mean? At too low of a dose, it might not work for you at all. At too high of a dose, it might have the opposite effects. So if someone's taking it for constipation or diarrhea, I would just caution, work your way up slowly. I have had, an instance here or there where someone said, actually I was taking it for diarrhea and it made me go more. My response, that's great. We know it's impacting your GI system. We just need to cut it back. We were probably on the wrong side of that bell curve, okay? So what we advise people to do is we usually start them off pretty low, somewhere between 5 to 10 milligrams a day. And then we have them just work their way up in increments. So 5 milligrams a day the first day, 5 milligrams extra the second day, 5 milligrams again the third day. Most people usually land around 40 to, I'd say, like 140 milligrams a day. I've seen literature going upwards of 400 milligrams a day for gastrointestinal issues. Yes, you can go that high. No, you're not going to overdose. But at that point, if you're taking more than 400 milligrams a day and you're not seeing a result of any sort, I go back to the drawing board. So really, it's anywhere between 5 milligrams a day up to 400. Work slow. In our offices, we like to start at 5 milligrams a day, then 10 milligrams, then 15, then 20, until we find that sweet spot where that person is saying, hey, you know what? I slept better. I was less anxious today. And what do you know? I'm not having that normal GI discomfort that I always have.